tulipoanza miaka 5 sasa kushirikiana na CDC kutekeleza wajibu wa.
Now, my name is Franz Moneri. I'm working with the Better Poverty Eradication Organization as a programs coordinator. And our programs are involved in the HIV and AIDS prevention using evidence-based interventions. Betapeo is located in Kabete constituency of Kabete district within Kiambu district. We have been able to reach the whole of Kiambu county because we had another office in Gatundu North, which was serving both Gatundu North and Gatundu South, and also part of Thika district. And we also have quite a number of facilitators in Remuru, Rari, and also Kiambu town. The organization structure has a board which was actually created through an AGM. So the first level of the organization is actually the AGM. Then we have a board of directors that has 7 members. And there below we have a team of management staff. And below the management staff we have the facilitators within the organization who are spread within the whole country. The activities we have been involved in, originally we were dealing with the peer education of HIV and AIDS prevention using abstinence, be faithful, and condom use within the county. Thereafter, we improved on that and we started implementing the Families Matter program, which involves training of parents, guardians, or caretakers of children between the ages of 9 and 12 to be comfortable and confident educators, sex educators to their children, when they still enjoy the confidence of the children.
Have undergone this program of Better Poverty Eradication, a program in Families Matter. And for sure, because I took it back in 2010. And there are many things that I learned in this place or in this program, because it really helped me in a way. I've been able to help my children, because there before I could not be able even to answer a question from my children, because they could ask a question. It was very difficult for me to answer, but currently now I answer all the questions they ask about what they face, as in with their peer groups, even in school. Even sometimes they come and ask me some questions even about what they learn in school, especially in changes that occur in both boys and girls during adolescence. As in nowadays, in fact, they are starting very early when they are 9 to 12 years. So since I learned this program, I've been able to answer the questions. Also in school, I was wondering how I could answer even the questions even when I'm teaching. Because there you have to follow the curriculum and follow maybe the schedules and give them what is in the books. But now, since I learned this, I'm able even to go beyond what is written in the curriculum. This has really helped me.
I am Mary Mobidongo, the founder member of Better Poverty Eradication, which started the year 2008. This resulted as a result of doing a lot of work with farming community. Since professionally I was agricultural officer, and I found that there's a lot of poverty within the farming community. And as we started with farming community, having groups of flower farmers, small-scale flower farmers. We called ourselves Mami Flowers. We thought we could finish the poverty by exporting flowers to Holland. That was not the case, because as we continued, we found very many people being affected by HIV and AIDS. Farmers wasting a lot of time going to hospital and having a lot of people being buried as a result of HIV and AIDS. So I found it was not only the marketing issue that can prevent poverty, but other issues as well can do. We started working in partnership with Liverpool Care and Treatment, who have really brought us up. Because I remember when we started, we didn't know head or tail. We don't know the difference between the board members and management team. They have really trained us and made us to become an organization which knows who are board members, which is human resource management. We didn't know all this, but after they have built us our capacity, now we are able to know what is what. We hope our objective of eradicating or reducing poverty is going to be achieved. We continue working hard in hand. Even other government officers will collaborate with the Minister of Agriculture, Minister of Health, Minister of Livestock, and even Minister of Natural Resources, because there are some group that plant trees.
Okay, after I went for visit, I tested positive, whereby my husband tested negative. So it was very hard for us, both of us, to accommodate each other after the results. Then after being introduced to the better pair, I was able to accommodate him as my husband, and he was also able to accommodate me as his wife. About the programs in the PWP, they are the programs that cater about social welfare, economic welfare, and then health. As a matter of health, there is the nutrition department, whereby after being introduced to different ministries, Ministry of Livestock, Ministry of Agriculture, I was able to accommodate myself in the program of rabbit rearing, whereby I get my nutrition there because of the white meat. And then after that, I was able to make my own kitchen garden, whereby I get my vegetables there for my nutrition. And after that, I was even able to reach my community and other people who are tested after me, at least to help them accommodate themselves in that condition of being positive.
I work with the Ministry of Agriculture. I'm from Kikuyu Sub-County and Kiambu County. We have been working together, we have been collaborating with the Better Poverty Eradication Organization. We have been training them on agriculture. And because even in agriculture we train on HIV and AIDS, we have been collaborating. So we have been training on good nutrition. We have been doing farming with them. Just like behind there you saw some things we are calling multi-story gardens, whereby we have trained the farmers or the people who are infected by HIV how to plant the vegetables in those polythene bags. And those who cannot afford the polythene bags, we train them to use the gunny bags, whatever they have at home. And because we don't have enough land, mostly here in Kiambu, so we tell them even they can put them as flower beds. So they get enough for their families and also they can sell.
We've worked with our donors, LVCT, the last 5 years, built up a partnership. They've built our capacity in every way. We've worked with the Government of Kenya and National AIDS Control Council in implementing 2 of their programs. We've also worked with the communities and for better payer sustainability. That is where it is pegged within the communities. One of our targets is to have a budget that is 50-50. That is donor funding 50% and better payers own sustainability 50%, which we are trying to target that by June of 2015. It's a bit difficult, but it is possible. It is possible by then. The organization is not where it was 5 years ago, yeah, or even 3 years ago. Yeah? We have a lot of potential. Yeah? We have been able to reach out within the whole of Kiambu County, and the only thing that is left is to go nationwide.
Yes, as a Ministry of Coordination, we have seen several people who have been working together with the National AIDS Control Council, because as a ministry you cannot work alone, and even as a neighbor you need to know your neighbor next. So what they normally do, we have seen Better Poverty Eradication Organization, which has was introduced sometimes in 2009, and whenever we have a meeting, they have been coming to our meeting. We introduce them, and on various occasions they have been having a setup of groups. They visit groups, educate them on HIV and AIDS and awareness. So we have seen them moving from one group to the other. For example, we are having a bypass right now coming into Kikuyu and outside. And when a new development comes, they have several challenges to come, because, for example, we'll be having a stopover for the wrong track. And when you have a stopover for wrong track, there are those challenges we come together with those. So it's a high time we also educate more and more, have more brothers, have more groups educated on this, because if we keep quiet at this time, we may lose some people, which we don't want, because our main core value is to protect life and property. So it's a high time we join with those who are collaborating with the National AIDS Control Council, poverty eradication people, and others who are working toward the same goal.
When we started working with them, they actually proved to us that what they are actually trying to do is not just HIV prevention. They are actually trying to eradicate poverty in the communities that they work with. And that has come out more clearly and stronger now that, we've walked the Ungana journey with them. When we started off with Better Peo, I think one of the things that attracted us to them was they had very good community reach. They were able to mobilize the community through very interesting ways, and they were able to reach anybody and everybody within the community. That is the Kiambu County where they work. And we thought this was such potential that we really needed to harness. They did not have structured HIV prevention programs. They actually did not even know much about HIV, but they knew it was a problem, and it was a problem that needed to be dealt with.
Tulipoanza miaka mitano sasa kushirikiana na CDC kutekeleza wajibu wa kusaidia kuangamiza